Hello and welcome to the 2021 Open Enrollment Retiree Webinar. My name is Melanie Denning from Healthcare and Benefits Division, HCBD, and the purpose of today's webinar is to educate retirees regarding the 2021 open enrollment period and the state plan changes that will be implemented on January 1st, 2021. This information is provided so you're prepared to complete your open enrollment elections by the deadline and understand the details for the 2021 plan year. So let's get started. If you have questions after the presentation, please contact HCBD either by calling us at 800-287-8266 or by emailing us at benefitsquestions@mt.gov. By now, you should have received a postcard from HCBD which provides the Zoom webinar details and website information on how to access the pre-recorded webinar. Due to COVID-19 pandemic, there will be no live retiree sessions held this year. However, there will be 5 retiree Zoom webinars as outlined here on this slide and on the postcard. These sessions allow you the ability to ask questions during the presentation and get real-time answers. Open enrollment booklets were also mailed to employees in mid-October, and retirees must complete their open enrollment elections by November 7th. You may do so online. Retirees are also going to be mailed a paper enrollment form that also can be completed in lieu of the online enrollment. Either you may choose online election or the paper form election, and you need to complete one or the other if you wish to make enrollment changes and avoid the tobacco surcharge, which we are going to discuss in the coming slides. Please remember, you do not have to complete both online and paper election. Please just pick the option that works best for you. Before we get into the open enrollment details, we wanted to provide some reminders regarding the State of Montana Benefit Plan or state plan. The state plan is self-funded. The funding comes from monthly employer, employee, legislator, and your retiree contributions. The contributions are held by the state plan and then used to pay state plan expenses, the vast majority of which are claims for services we incur by the members for medical, prescription, and dental needs. When you balance the income and the expenses, you get the state plan reserve. State plan reserves are needed because we can't control all the variables surrounding operating a state plan. Although we can control many of our plan costs, there are definitely some that we just don't have direct control over. This includes our largest income source, which is the employer contribution. The employer contribution is set by the legislature, and although HCBD provides funding recommendations every 2 years to the legislature, the contribution is ultimately set by the legislature, and we must adhere to the funding recommendations. After complying with the funding set by legislature, the employer contribution then has not changed for 4 years and is not planned to change in 2021. Federal mandates also impact the state plan expenses, and for example, in 2018, the state plan was required to begin covering statins, which are cholesterol-lowering medications, at a $0 copay due to the Affordable Health Care Act, or ACA. In addition, due to recent changes in mental health parity regulations, the state plan has enhanced some of the coverages available for behavioral health and addiction treatment services. HCBD works hard to estimate and evaluate our expenses so that we have a general idea of the volume of claims each year, but they can certainly be surprises. Medical trend and the increasing cost of medical care is a huge variable that the state plan has little control over. It's difficult to predict. The cost of medical procedures and prescription medications continue to rise year after year. The state plan needs to always have enough money in reserves to cover all 30,000 plus members when they need us. The state of Montana continues to implement innovative solutions to address the ever-rising cost of healthcare. Solutions such as reference-based pricing, partnerships with best-in-class vendors such as Navitas Healthcare Solutions, and the implementation of the new value-based programs such as medication therapy management and the remote blood pressure management program. This ensures the state plan can continually maintain state plan benefits and contributions. Our strategies have been successful in allowing state plan members and the state plan to control costs, also effectively manage the state plan, and improve the health outcomes for you, our members. HCBD will continue its efforts to control costs and manage state plan. We'll continue to work with Montana hospitals and other partners to address the rising costs of health care on behalf of the state plan members and taxpayers of the state of Montana. As a result of HCBD's efforts, we're excited to announce that retiree contributions are not increasing for 2021. This applies to both Medicare and non-Medicare retirees. This slide reflects the contributions and the contribution increase amount for the medical plan for non-Medicare retirees. And noted in the 2021 percentage column, there's a 0% increase in your contribution for 2021. This slide reflects the contributions and the contribution increase for the medical plan for Medicare retirees. Again, like I said, on the 2021 percentage increase column, there's a 0% increase for 2021. This slide shows you the contributions for dental, vision hardware, and basic life if it applies to you. These plans also have had a 0% increase for contributions in 2021. If you are currently paying your monthly contributions with a check or money order, we need you to pay attention to this next section. This applies to you. Because effective January 1st, 2021, coupon booklets will no longer be available. HCBD strongly encourages you to sign up for automatic withdrawal, or ACH, from your checking or savings account. ACH can be set up online at benefits.mt.gov. You can click on the green button, Make a Payment. If you do not elect ACH and you wish to continue paying your monthly contributions with a check or a money order, there are monthly statements that are available if you sign on online to our system. You will not receive a mailed invoice, however. But if you do have an email on file with us, we would send you email reminders when the monthly statements are available. So if you're currently paying your contributions via ACH already, or you're using the PERS or MPERA deduction, you don't have to change anything. In addition to no contribution increases, there will also be no change to the medical plan out-of-pocket costs. So this means that medical plan copays, deductibles, and the maximum out-of-pocket costs are going to stay the same for 2021. You can refer to the Retiree Open Enrollment Booklet, our HCBD website, or the WRAP plan document that we mail you for additional state plan coverage information. Did you know that you can get a 3-month supply of maintenance medications at your local retail pharmacy or at a mail order pharmacy? Maintenance medications are those medicines that are used to treat chronic long-term conditions, examples such as diabetes, high blood pressure, asthma, and others. Schedule 2 and Schedule 3 prescription medications, these are narcotics. Those are still limited to a 34-day supply, however. To get started, you just request your prescriber write down the prescription for a 90-day supply. Then you'll get a 90-day or 3-month supply, and you only have to pay 2 copayments. Most participating in-network pharmacies can dispense the 90-day supply, but if you would like, you may also get a 90-day supply through the mail using the state plan mail order vendors. Mail order vendors are Costco, and you don't have to be a Costco member, MyRx Pharmacy, or Ridgeway Mail Order Pharmacy. Surviving spouses or domestic partners and their dependent child or children of retirees that pass away can stay on coverage with the state plan. The coverage under the retiree's benefit would terminate on the last day of the month in which the retiree passes away. Then the surviving dependent will receive a survivor enrollment packet, and they may enroll in survivor benefits that would be effective the first of the month following the termination of the retiree coverage. Once you're enrolled in survivor benefits, then the dependent may remain on the state plan until they voluntarily terminate coverage or they pass away. But contributions, of course, must still be paid monthly. This is important change that will be effective January 1st, 2021. The state plan is implementing something called a tobacco surcharge, and this will be for plan members who use nicotine. The surcharge is going to add $30 to your monthly contribution amount for any retiree who uses nicotine, and an additional $30 per month if the retiree's covered spouse or domestic partner uses nicotine. The tobacco surcharge is a separate surcharge and is not the same as the Live Life Well incentive. In order to earn the Live Life Well incentive, plan members must follow the instructions found on our website at benefits.mt.gov/incentive. You still must self-report your nicotine status and activities required at the myactivehealth.com/SOM website. This important change means that in order for you to avoid having an additional unexpected monthly cost added in 2021, you must complete your open enrollment elections this year. When you complete your open enrollment elections, you will be taken to or required to indicate if you are nicotine-free or if you're a nicotine user. Here are the definitions of those two. Nicotine is an addictive stimulant proven to have negative health effects and is found in cigarettes, cigars, chewing tobacco, and most vaping products. Nicotine-free is that if you are nicotine-free, if you've never used nicotine, if you've quit using nicotine, or you infrequently use nicotine less than 4 times a month. You're also nicotine-free if you're currently using nicotine but completed one of our eligible alternative programs, such as nicotine cessation program, or you've had a nicotine counseling session with a medical provider, and that's had to have been in the last 12 months. The definition of a nicotine user is that you are a nicotine user if you currently use nicotine and have not completed an eligible alternative, which is the nicotine cessation program or a nicotine counseling session with a medical provider during the last 12 months. During open enrollment process, you must indicate yours and, if applicable, your covered spouse or domestic partner's nicotine status. If you fail to complete your open enrollment elections, it will result in you and, if applicable, your covered spouse or domestic partner being automatically charged that nicotine surcharge. So action is required by you during open enrollment. Although this slide is small print, the point is to show you that there is a tobacco surcharge question that is asked you during the online open enrollment election. It is also included on the printed election form that you will receive in the mail. Again, it's imperative that you complete open enrollment elections for 2021, or you're automatically going to be charged that surcharge for yourself and, if applicable, your covered spouse or domestic partner. During the open enrollment elections, you will either choose yes, you're a nicotine user and charge the $30 tobacco surcharge, or you will choose no, you are not a nicotine user and the tobacco surcharge gets waived. And if you have a spouse or domestic partner covered on the plan, you'll be prompted to answer the very same questions for your spouse or domestic partner. If you answer yes on them, they too will be charged a monthly tobacco surcharge for the spouse or domestic partner. So the retiree contributions are outlined in the Retiree Open Enrollment booklet mailed to your home, but the booklets will also be posted online on the HCBD website at benefits.mt.gov/open enrollment. You may also locate the retiree contributions by clicking on the resources button across the top, scrolling down the drop-down menu and clicking rates, and then clicking on 2021. There's also more information regarding the tobacco surcharge on the HCBD website. Again, under the Resources drop-down menu, click on Tobacco Surcharge. To access online eligibility system, you go to www.benefits.mt.gov and select Existing Member Benefit Changes. This is so you can view your billing statement or to self-pay. If you're a first-time user, just click on Register and set up a username and password and answer some security questions. The company key is State of Montana, no spaces, lowercase. We will pre-fill that in for you. If you've already registered on the system in a previous time, but you've forgotten your username and password, please just click on Forgot Username and Password and you will receive assistance to retrieve it. As a reminder, once you and/or your covered dependents become Medicare eligible, you must enroll in Medicare Part A and B. You will then be automatically enrolled in the state plan Part D prescription drug coverage plan. Please be aware you cannot sign up for any other Medicare Part D prescription drug coverage, because if you do, you won't be allowed to stay on any of the state plan benefits, medical, prescription, dental, vision, or life insurance if that applies to you. HCBD will require proof of your Medicare enrollment and you will automatically be charged the Medicare retiree contribution amount. Your monthly contribution is reduced when you become Medicare eligible because the state plan will then become a secondary coverage to Medicare. Medicare will be primary payer for all of your medical claims. When you retired, you elected to stay on the state plan, which provided the same coverage you had in place as an active employee. However, we did want to take a minute and remind you there might be other options that may be more financially beneficial for you than staying on the state plan. One of these alternatives for non-Medicare retirees is the health insurance marketplace at www.healthcare.gov. For Medicare retirees, Medicare supplements may be a lower cost alternative, and for more information on these alternatives, please contact the State Health Insurance Program or SHIP representative in your area by calling 800-551-3191, or you can contact the Agency on Aging, the Rocky Mountain Development Council at 406-457-7368. Let's talk about the 2021 Live Life Well Incentive Program. Don't forget the 2020 Live Life Well Incentive deadline is this October 31st, 2020. Don't miss out. Completing all the required Live Life Well activities and completing your self-reporting requirements will allow you to receive the entire Live Life Well incentive toward your 2021 monthly contribution. Hopefully you've already had a state-sponsored health screening, and although we've set many reminders, remember you have to do all 3 requirements to get any incentive. Although we've added extra screening opportunities at the health centers in October, we cannot guarantee members can get in if they have waited. Incentives earned in 2020, again, will be applied toward your 2021 state plan year contributions. Please visit the www.benefits.mt.gov/incentive to see complete instructions and more detail regarding the incentive. Participation in a state-sponsored health screening will automatically be reported to that My Active Health website, but it does take about a month from the date of your screening to show up on that website. In order to earn the incentive, you also must self-report your nicotine status or alternate activity and your next step activity in the My Active Health website. Even if you completed a wellness challenge, like the Governor's Stay Active Challenge, you still need to go out onto the website and self-report that activity on My Active Health to earn the entire incentive. There are additional instructions that are available on our website at benefits.mt.gov/incentive. If you're all ready to self-report, you will go to myactivehealth.com to do that. We do recommend, though, that you review the information on our benefits website, benefits.mt.gov/incentive page, prior to self-reporting your nicotine and next step activity. Remember, self-reporting of your nicotine status use in the My Active Health website is not the same as completing your open enrollment election, where you will also need to provide your nicotine use status for the tobacco surcharge. If you don't have internet access, you may request a paper form to self-report for your incentive activities. And if you need a paper form, contact us, HCBD, and those forms must be returned to us by October 31st, 2020. Let's talk about next year, 2021's Live Life Well Incentive Program. It will begin this year, November 1st, 2020. We want to make sure that everyone is aware that for 2021, that third component of the Live Life Well incentive is changing. So pay close attention to this next slide. Instead of completing a next step activity next year, instead you will complete and self-report that you have completed a provider visit between November 1st, 2020 and October 31st, 2021. What is an eligible provider visit? It is an annual physical examination with a medical provider. This will be an appointment where your doctor gives you a complete physical examination based on your age, gender, and other factors. This examination should include a discussion of your health screening results. So after your health screening, bring your results along with you so you and your doctor can review the results during your appointment. If you have a medication that you take every day, or simply regular medications, your doctor may renew those medications at your appointment. You may choose a medical doctor that best fits your personal needs, but any kind of medical doctor is acceptable, from a family practitioner to a specialist. It may just depend on who is most appropriate for you, but keep in mind that the regular benefits apply to this visit, and any additional services beyond the provider's time may incur extra expenses. If non-Medicare member retirees attend a provider visit at a health center, the out-of-pocket costs do not apply to services provided. Many of the next step activities we currently offer will continue to be offered. They just will not be eligible activities in order to earn the Live Life Well incentive. If there's a reason that you can't complete any part of the Live Life Well incentive program, there are exceptions and alternatives available. This relates both to the 2020 and the 2021 Live Life Well incentive programs. You can contact HCBD to learn more. Here's a list of the Live Life Well contacts for the incentive program. My Active Health, where you self-report your nicotine status and this year your Live Life Well activity, and next year your nicotine status and your provider visit. Montana Health Centers, where you have your health screening, and our wellness contact information at Healthcare and Benefits. This year's open enrollment period runs from October 25th to November 7th. And you will have from October 25th to November 7th to make your benefit elections for the 2021 plan year online at www.benefits.mt.gov. Then you will select Start Here for open enrollment. The Start Here for open enrollment button does not appear on our website until the open enrollment system is actually available. This year, you may also complete and return your paper election, and it will be mailed to you in mid-October. But again, you only complete one or the other, whichever is best for you. It's important that you complete either the online or the open enrollment election if you wish to avoid that tobacco surcharge. Remember, online and paper elections have to be completed or returned postmarked by November 7th, 2020. So any questions, contact our office. During open enrollment period, you can make changes to your coverage, like enrolling in or waiving the state plan. You can also add or delete dependents from the plan. However, remember, if you want the Vision hardware plan, you have to complete open enrollment. And in bright red letters the whole time on this slide, remember, retirees must complete open enrollment if you want to avoid the tobacco surcharge. If you do not complete open enrollment this year, you're going to have the same medical, dental, and basic life insurance, if that applies to you, that you currently have in 2020, and you will have it for the entire 2021 plan year, unless you qualify for a special open enrollment period. If you do nothing, you, and if applicable, your covered spouse or domestic partner will automatically be charged that tobacco surcharge. Also, enrollment in the Vision hardware plan will end January 1st, 2021 if you do nothing. So to begin open enrollment, you can access our website at benefits.mt.gov. You will select the red button that says click here to start open enrollment, but remember that red button will only be visible during open enrollment. If you're a first-time user, you click on register to set up a username, password, and answer some security questions. And remember, our company key is State of Montana, and that will be pre-filled in for you. If you registered last year and have forgotten your login information, click on Forgot Username or Password, and you will get assistance retrieving it. Once you're logged in, you will need to read several important reminders before you start in on your enrollment. So please take time to read them. Once you're logged in, you can click on Start Here. Then follow the instructions to complete your open enrollment elections. Remember, you must have completed your open enrollment elections by November 7th, and the system shows you the number of days remaining to complete your enrollment. Once you're logged in, please read several important reminders before you start your enrollment process. To begin with, you'll be taken to an About You page, and here you must verify your information. And if you have dependents, you will also be taken to a dependent page to review as well. So take a moment and review the information on this page and assure that it's correct. If it's correct, click Next, and if applicable, you will be asked to review your dependents for accuracy, and at that time may add an additional dependent if that is applicable to you. Remember, at the top of each page is a blue box containing important information for that page and the benefit, so please read it. Much time has been spent to ensure these instructions are helpful and understandable. As you complete your elections, there's a running total that you can see at the top of the page. It reflects the total cost for you on a monthly basis. At the end, there will be a summary where you can review the breakdown of this monthly cost. You'll navigate through each benefit, beginning with medical, and as a reminder, at the top there is a blue box with important information that you must read. When you elect medical coverage, remember, you will also be prompted to elect your vision benefit. You will select from basic vision or the vision hardware plan. Once one of these two options are selected, then you're going to be allowed to continue, but you must select one or the other. This example on the slide shows that the medical plan with basic vision was selected. Next, you'll have to indicate your nicotine use like we described. We ask you to please read the instructions at the top of the page carefully. You must select either yes, you are a nicotine user, or no, you are not a nicotine user for yourself and, if applicable, your covered spouse or domestic partner. If nothing's selected, you aren't going to be able to move past this screen. It's important to note that if you're a nicotine user but you've completed an eligible alternative, you can select no. So go to our webpage, benefits.mt.gov/tobacco surcharge for more information on the tobacco surcharge and the agreeable alternative exceptions. This shows retiree and medical spouse election summary. Both in this example are nicotine users, so the tobacco surcharge for each one is listed. Remember, this is a monthly amount, so the total for the retiree and spouse in this example is an additional $60 per month. When you reach the vision benefit page, remember, you elected vision benefits already back in the medical section. So if there's changes needed in this section, you have to click the back arrow and go back to the medical section to make your change. If you elected the medical plan with vision hardware, the premium for that will be listed on the next screen for you to review. You should be able to then continue through each benefit offered you, dental and life insurance if that applies, and each benefit offering has important information at the top of the page to read closely. You can review each of your elections and the associated costs before you approve your benefit elections, but when you get to this page, it's extremely important for you to scroll all the way down and review the entire page and each of the different elections. If you notice a change needs to be made, you can click on the edit button right next to the benefit, and then you'll be prompted to review and modify the enrollment for that benefit. This page also has the tobacco surcharge and the Live Life Well incentive, if you've earned it, listed on it. It's at the bottom of the review page, and you can see your cost, and there's a total monthly cost for you to review. Once you're satisfied, click on the Approve button. If at any time you decide you need to make changes, after you click Approve, you can do that on system up until open enrollment closes on November 7th. If you added dependents, you're going to be prompted to provide documentation that shows the dependent meets the eligibility requirements of the state plan. This page shows what documentation is required for each type of added dependent. You can submit the documentation right here at this point by clicking on the Upload Now button. Or, if easier to gather documents later, you can scan and email them to us, you can mail them postal mail, or you can fax the documentation. Dependent verification documents must be received by Healthcare and Benefits by December 30th, 2020 for the dependent to be added to your plan effective January 1st, 2021. Then when you're complete, you will be taken to a confirmation page, and there you may print a copy of your elections. You can click on the Benefit Summary button up at the top corner, and we highly recommend you print or save a copy on your computer. You also have the option this year again to download the My Choice mobile app if you have a mobile device or maybe a tablet to complete your open enrollment elections. The app is easy to download and then install and is available for you to use all year long. So you can add updates and changes that you may have, which is a great way to keep us up to date on your address so that you won't miss out on any important mailings. To get started adding the mobile app to your device, first you will go to the HCBD website and click on the second green box in the row, Existing Member Benefit Changes. Once you click on this box, it will open a page and you get into the system, and there's a Get Access Code button in the opening page in the upper right-hand corner of the screen. You then choose the phone operating system and you enter your mobile phone number, and you will receive a text on your mobile phone or device and a link to download the application on your device. So let the download happen. Once it's done, it's going to ask for that access code. You need to get the access code off the computer and the page you just opened, listed in step 2 from the website. You enter that on your mobile device and it will sync up the mobile device with the enrollment system, and you'll be able to complete your benefit elections using the mobile application. In early December, you will receive notification from HCBD that it's time to review your finalized 2021 benefit summary. Watch for that notification. Then you can go online and make sure that we have you enrolled correctly for 2021. As a side note, if you completed your elections online, you can also view a 2021 benefit summary at that time by returning to the home page and clicking on Review under the To-Do section next to Open Enrollment. And again this year, a quick reminder that during Open Enrollment, we send you other important documents coming from Healthcare and Benefits, including the WRAP Plan Document, or WPD, for 2021. And it outlines everything that's covered on our state plan. State plan members also get that Summary of Benefits Coverage document, which is a legal document required by the Affordable Health Care Act, but it's a short summary of our plan. You'll get a Medicare Part D creditable coverage letter and a few other legal notices. Thank you for attending today. And please know that we are happy to take your questions or emails on any topic you have during open enrollment and always. Check our website frequently for updates. That's where we post open enrollment tools, health screenings, flu shot schedules, and incentive information. Thank you.